Oh, so welcome everybody to our Family University with David Kelly in our benefit series. Tonight we're going to be going over to Ticket to Work, Medicaid and Medicare, overpayments, and ABLE accounts. If you have any questions, please feel free to put them in the chat. I will monitor that throughout the session. And then of course you can always unmute and interrupt us. We're pretty good about that, I think. And if without further ado, sorry, I had to let somebody in quick. I turn it over to you, David, and I'm going to spotlight you so it highlights everything that you're saying. So you should be spotlighted, and it is all yours.
All right, thank you, Patria. So good evening, everybody. Like Patria introduced me, my name is David Kelly. I'm the Disability Resource Coordinator for Finger Lakes Works, and I encompass Ontario, Seneca, Yates, and Waynes County. Tonight is a lot of information. It's very jam-packed. It's just a lot. I tried to minimize as much as I could so it wasn't overly painful, but it's all important information that we want to cover. So we're going to get right into it. Well, I always do this when I start, as this thing does not want to work. And then this is what's being presented today. So we are going to look at the Ticket to Work system first. We'll look at a short overview of what it is, the employment networks and vocational rehabs, and the benefits of the system in whole. We're going to do pretty much a deep dive into Medicare and Medicaid to just get a more familiarized with it. By no means am I a professional, but we do have some information that we're going to share. We're going to take a dive into overpayments, and lastly, we'll wrap it up with New York ABLE accounts and the benefits that can be reaped from them. So Ticket to Work, the Social Security Administration Ticket to Work program was created for this reason. It's to help people with disabilities go to work and reach financial self-sufficiency. It helps decrease reliance on the SSA benefits as well, and provides individuals with both a choice of providers and services at a no-cost rate. Ticket to Work is an employment program that helps SSA beneficiaries achieve their employment goals. And the eligibility is really simple. An individual needs to receive SSI or SSDI benefits, and the individual needs to be between the ages of 18 and 64. Those are the only requirements for eligibility. I hit the scroll wheel. Now I don't know if I'm too far ahead. As the Social Security Administration identifies an individual as eligible for the Ticket to Work program, between obviously the appropriate age range and receiving benefits, the Social Security Administration will send the individual a letter at their last known address that's on file. And this letter will contain the basic information about Ticket to Work program. Typically, they send a brochure along with it, and it's a very nice brochure. I have copies of them in my office, so if any of them would like them, I could send it out in email later on too to Patria, so you can see the brochures for the Ticket to Work program. And it gives you a layout of details of everything that I'm pretty much going to go over. And it will also provide you a list of providers who are eligible under the Ticket to Work program, because we look at Access VR as a vocational rehabilitation program that is under the Ticket to Work system. I believe Commission for the Blind is as well. And along with other providers such as Finger Lakes Works as an employment network, we're not a vocational rehab, but we also fall under the Ticket to Work system. And the individual does not have to participate in this program if they choose not to. It's just an option that's there for them. The benefits of the Ticket to Work program is that it's free and voluntary at the beneficiary's discretion. And while a ticket is active, the SSA beneficiary will be exempt from continuing disability reviews or CDRs, as long as they're making timely progress. And we're not going to get much into what timely progress means, so there's a small definition down below. But most of the time, if you meet for a ticket to assign your ticket to an employment network, there are some paperwork that does have to be done, and that covers most of the timely progress. So they'll talk about that more in detail during that meeting. The ticket program connects an individual with no-cost employment services to help. So this will help them to decide if work is right for them, prepare an individual for work. They help with job searches, resume building, mock interviews. They do a lot more than just basic job search, but it's just that generic umbrella. And it helps them maintain employment too through supports that might be needed or built around the employment or that individual to be successful. The Ticket to Work program, like I said, is a voluntary program, and it offers Social Security beneficiaries greater choice in obtaining the support and services they need to help them go to work and achieve their ultimate career goal or employment outlook. It does provide payments to participating employment networks for assisting beneficiaries in obtaining that gainful employment, but it's very small and it's at no charge to that individual. The goal is reduced. I'm sorry. The goal is to reduce reliance on the Social Security benefits and increase self-sufficiency. Ticket to work, and this is the assignment kind of deal where a VR and an EN comes into place. So this is where the key documents that would be reviewed if you were going to assign your ticket with a vocational rehabilitation program or an employment network. And they're going to cover what's called the NYESS customer consent form. So that's to make sure that you understand what you're assigning your ticket to and what it's for. They'll provide you with a fact sheet that also has to be signed, and that's just everything that we pretty much covered. The brochure, again, is brought up just so that way, again, you have more information at your disposal. They will do, once all those first things are assigned, they typically have a secondary meeting. I know for my participants, I always schedule the individualized work plan as a secondary meeting, because this is where you talk about that timely progress. We really set your career goal, be it they want to be an electrician or they want to be, in something in agriculture. We really take, well, what's the beginning steps to the end steps. And the goal typically ranges 6 months to a year, and then 3 years to 5-year plan out. So we typically do one every year. We re-up it to make sure we're on timely progress and that your goal is still the same. And then we make sure that the 3 to 5 year goal is still the main objective when we redo the yearly plans. So each one of these forms should be completed with the beneficiary during a meeting with the VR or the EM. In assigning the customer consent form, the beneficiary is agreeing to use his or her ticket with the state VR agency or employment network of their choice. At the end of or case closure, beneficiaries are informed that the ticket still has value. So once you move on from an agency, be it the services are exhausted and maybe you can get something somewhere else, or if you're unsatisfied with services, you do have the ability to reassign your ticket to another employment network or via vocational rehabilitation program. And this will ultimately support and maintain advancement in employment. And while the beneficiary's vocational rehabilitation case is open, that case cannot be assigned to another EN. So if you're working with Access VR and you wanted to come work with me as well, I couldn't necessarily use the ticket to work, but we could still benefit from the services that I might be able to provide. And then later on, if that person decides, well, I'm done with Access VR and they wanted to assign the ticket to my EN, then they would just have that conversation with me. We would pick up on the goals of the vocational rehabilitation program, and then we would move forward towards that employment goal.
David, quick clarification on that, because I want to make sure I heard you correctly.
Yep.
So if they're open with, let's say, Access VR, and they decide to move over to you under the employment network at Finger Lakes Works, do they initiate that with Social Security Administration, or do you assist with that, like, transition of agencies? Because I thought I heard you say you assist with that transition, but I want to make sure I heard you correctly.
Yeah, typically whatever network you're going to. So if you're shifting from me to Access VR, vice versa, or whatever network, typically whoever's picking up the ticket engages with the NYESS system, because we had to go through significant stuff to do it. So the provider should be the one engaging, but the customer should tell the provider they want to move their ticket for whatever reason.
Okay, great. Thank you.
Yep. And I think I finished that one. I'm just going to read the last line out real quick. So if the beneficiary becomes dissatisfied with his or her VR services or employment network, the ticket can be unassigned and then reassigned to the EN. And then just to clarify again, it is on, typically on the next employment network to engage with the system in order to receive that ticket. But you will have to fill out new paperwork to make sure that, you want to be consenting to that program. The next slides are winded, and I apologize, but it is about Medicare and Medicaid and the difference in what they provide. So for a blurb, Medicare, as listed, is a federal insurance program. There is no state-to-state variation, and Medicare is 100% federally funded along with beneficiary premiums. Medicaid is a publicly funded health insurance program. The federal government does set the parameters for Medicaid, but the states have significant flexibility with the benefits and eligibility criteria, and they do send those out to the federal government for approval. Funding is divided between the federal government and the states, with the federal government covering from 55% in many states to 80% in the poorer states. There is dual eligibility for Medicare and Medicaid, and this came up pretty quick in the slides, which is why it's thrown in there kind of awkwardly. But this is when some individual receives both Medicare and Medicaid, and it is possible to receive both. These individuals are referred to as dual eligibles. Medicare pays primary medical expenses, and then the Medicaid picks up any secondary cost that might be left over. So the dual eligibles generally have comprehensive coverage from both health insurances and long-term care services and pay very little for that coverage overall. Now is the parts of Medicare. So Medicare has 4 parts: hospital insurance, or Part A. I mainly work with Part A and Part B. Part C's and D's, typically health insurance companies take more focus on those, but I understand A and B because most Title II beneficiaries have this kind of system where I have to work with Part A and Part B. But Part A is financed through FICA tax, and this pays for inpatient hospital cares and certain follow-up visits. Part B, it pays for doctor services and various medical services not covered by Part A. And this one is voluntary and financed through monthly premiums paid by beneficiaries opting for coverage. And as of the first of the year 2023, it was $164.90. I do not have the new stat. I apologize, but I will send that out to Petrea at when I send her the slides. There is a Medicare waiting period. So we talked about this during the Title II or SSDI portion of our trainings here. So a qualifying period for Title II beneficiaries is 24 months. There are some exemptions for this. So the 24-month period is waived if an individual has a primary or secondary diagnosis of ALS. If the individual has end-stage renal disease, they qualify for Medicare on the basis earlier than 24 months. The 24 months are what's considered cash eligible months, and they do not include the 5-month waiting period to receive your Title II benefits when you apply for them. But they do include months if you were in the extended period of eligibility, even if the working beneficiary is not receiving a cash benefit. So pretty much because of the trial work period, how it's set up, you can begin it pretty early while waiting. If you began that, you might be an EPE when your Medicare starts kicking in. If that happens, obviously you can see here that those months will start counting towards your Medicare if you're working in your EPE. A little bit more about Medicare. So Medicare provides comprehensive health insurance. Most doctors around our area and around the country accept Medicare, and access to doctors and hospitals is generally not an issue. Area agencies like Office of the Aging in our communities are the key resources on Medicaid, and despite the name, they serve Medicare beneficiaries of all ages. Okay, that was the next one. Medicaid. So Medicaid is also known as the medical assistance and is a cooperative federal state authorized by Title, I can't remember the Roman numeral, but that's that one, of the Social Security Act. Medicaid has different names in some states. People in California refer to it as Medi-Cal, Tenacare in Tennessee. In most states, Medicaid is administered on the state level through the Department of Health or in some other similar entities. Medicare covers these particular things: inpatient and outpatient hospital care, physician services, mental health counseling, home health care, personal care, private duty nurses, physical therapy, occupational therapists, speech and language, prescription drugs, durable medical equipment, also known as DME, and additional services under medical waivers programs, which we are coming up to. Basic Medicaid eligibility. So in 42 states, these states are known as 1634 states. People on SSI or Social Security income get Medicaid automatically. New York State is a 1634 state, so if you are, if you get SSI, Medicaid comes with that in our state. Some former SSI beneficiaries continue to qualify for automatic Medicare. This is under the childhood disability benefits. We talked about that in the Title II benefits. In 8 states, these states are known as 209B states. SSI recipients must apply for Medicaid separately once awarded. A few of the 1634 states require a paper application to be filed, but the SSA disability determination is typically used with that application to prove that you're eligible. Medically needy or a spend down program. There are programs that exist as spend down programs. So if an individual is not eligible for SSI or was not a special former SSI beneficiary, the individual must pay separately for Medicaid. And if an individual's countable income is above the state income level, which you can find on the state sites, then in many states, the people that person is eligible for Medicaid, but must pay what's called a spend down. And it's always best practice to make sure that if you're not sure if we're in a medical spend down state or not, to check out the website to make sure to clarify. How working can affect the spend down. So under a traditional spend down program, budgeting is just going to be like an SSI budgeting that we went over in, I think, session 2. There's a disregard for the first $20 of income. The next $65 of income is also excluded, and then you divide that by 50%. There's a disregard of 100% for passes, blind work expenses, and any health insurance premiums that are being paid. There's a 50% disregard for impairment-related work expenses, and the remainder counts towards spend downs, what the beneficiary would pay to get that Medicaid. This is very confusing, and I would always suggest to reach out to a WIP or a DRC to really figure this out if needed. It can be confusing to try to do on your own. I still struggle with it, and I work with it kind of daily. Problems with spend down. So as a person's wage will increase over time as they get more experience, they get more trainings, they get more responsibilities at work. This will ultimately increase their wages. The spend down will increase by $1 for every 2 additional dollars earned after applying the earned income disregards, which is what's listed above. So for every $2 you make additionally, they will add a $1 towards your spend down limit that will need to be spent down to keep Medicaid. Well, watch for states that are beginning to do away with their spending or spend down programs. So you can look up that online as well. I don't have a list of them. I apologize for that. This is cutting off, so I can't really see the top of my slide here. Medicaid buy-in for the working people with disabilities. So 46 states have medical buy-in programs or MBI programs for working people with disabilities. The states listed there are the ones that do not. These programs allow people with significant disabilities who are working to purchase Medicaid for a premium. And these programs use the SSA's definition of disability, except with no substantial gain activity requirement. So that means there won't be a substantial gain or a level that will kind of throw it out of whack. If the state has an MBI program, check the eligibility requirements and the premiums. And this also can be found online as well. Now it doesn't want to work. There it goes. The next thing to continue on with Medicare and Medicaid, home and community-based waivers. So this is just a general overview. This is it Centers for Medicare and Medicaid Services, so CMSs, allows the state with prior approval to experiment with service delivery to show the effectiveness of delivery as well as the cost effectiveness. There's a couple waivers that are listed there. And then here's a waiver that's more kind of, you can understand it a little bit better. A waiver administered by the New York State Office of Mental Health, or OMH, allows children and adolescents with mental health issues to receive a range of services not otherwise available through traditional Medicaid programs. Waivers like this exist in every state. And again, it's best practice to check with state websites and ensure that work will not be impacted by a waiver for eligibility for important medical services. Some more information on waivers. Why waivers are important. So waivers often provide key services that cannot be replaced by traditional private health insurance, or that might cost more under these private health insurances. Maintaining waiver eligibility is often the main concern of somebody returning to work or of their family. And waivers are state specific, and you should always do your own research and learn about waivers more in your state, but you can also seek assistance from a WIP or a DRC. Waivers and work. So in many cases, waivers eligibility can be maintained by enrolling in the state Medicare buy-in for working people with disabilities program. And in many cases, waiver eligibility can be maintained by being in a 1619B status, which is a work incentive that we talked about in a couple presentations ago. And deeming of income does not apply to HCBS waivers. So if you're a parent whose income is being deemed under one of these waivers, it can't be deemed. Give it again. So now that we kind of beat that subject to death, we're going to talk about overpayments. And overpayments can be scary because they are money that the Social Security Administration has said that they overpaid you, and their chances are they're going to want you to pay it back. Overpayments of Title II programs or supplemental Social Security income, so Title II or SSDI. Overpayments are often caused by a delay in the Title II SGA decision. So this is due to them taking an extra time to say, oh, yep, this month you made an SGA, this month you didn't. And it's kind of that back and forth that we talked about during that session where the faucet kind of goes on and off, on and off. This is where an overpayment can happen and typically does. So when the 36-month EPE ends, if the beneficiary is engaged in substantial gain activities, benefits are terminated and the case file is closed. So this could occur immediately after the EPE or anytime after, depending on when SGA occurs. And if monthly cash benefits are not suspended or terminated at the appropriate time, the beneficiary is overpaid. And if that happens, the SSA will take the steps to recover the overpayment. If you're working with a DRC or WIP, we typically we track this with our participants, so that way they know when they're coming on to EPE, they know when they might have to request EXR, or they might know when the decision needs to be made that if you get a check at month 37, you probably should call the Social Security Administration, make sure that the check is supposed to be there. If it's not, to return it so an overpayment doesn't happen. These also get clarified during when we put in pay stubs to the Social Security Administration to prove that you're working under these work incentive programs. SSI overpayments frequently occur when the beneficiary's income changes from month to month, or the individual does not report income at the beginning of each month or before the 10th of each month. Typically, as discussed during the SSI session, you put your payment in for the month. That takes 2 months for that retroactively to show up. If the next couple months you don't have that same payment, then it should retroactively go back to what it balance out. We also, as DRCs and WIPs, we track this as well. These are more tracked on a monthly basis. Both of them are tracked on a monthly basis, but the SSI ones are tracked more scrutinized or like looked at heavier, because it can be a slight adjustment or one number off can throw it a little out of whack. Typically with SSI overpayments also occur when resources exceed the $2,000 limit, or when an individual has a change in unearned income, including getting married or receiving in-kind support and maintenance, which we also covered during those sessions. There is obviously, we've talked about the resource limit during that session as well, that anything over $2,000 is a bank account. After that, it's going to be considered an overpayment or an oversight, and they're going to take money back. And it didn't go again. So how does the SSA recover an overpayment? So to recover an overpayment, if the beneficiary is in what's called the pay status, the SSA will typically deduct a specific amount from the benefit payment. If the person is not in what's called the pay status, arrangements can be made to repay the amount in full or establish a payment plan. There are a couple rules here. So Title II benefits or SSDI, there's a 100% rule. So generally the SSA will withhold 100% of monthly Title II benefits until the entire overpayment is repaid. However, the beneficiaries may negotiate a lower monthly withholding with the SSA. For SSI, it's a 10% rule. So in practice, usually the 10% is computed using only the total benefits paid. However, the status and regulations clearly allow for 10% of monthly income, including all earned and unearned income, to be withheld from the benefits payable each month. I did it again. Additional ways they may also recover overpayments. So this is the ways that they can. They can do it through federal tax refunds, other federal payments such as federal travel and expenses, reimbursements, or benefits paid by the Departments of Veteran Affairs. A federal employee's salary, as long as the followings are true. This person is not currently receiving Title II or SSI benefits or Medicare based on disability. This person is not active in the Ticket to Work and Self-Sufficient program. The debt is $100 or more and was incurred after the person turned 18. Garnishes of wages from regular employees, if the following statements is true. The individual is entitled to Title II and SSI benefits from Medicare based on disability. The individual is active in the Ticket to Work and Self-Sufficient program. The debt is $200 or more, and the debt was established after age 18. And the individual was not already made arrangements to repay the debt. A provision called Cross Program Recovery or CPR allows the SSA to collect SSI overpayments from Title II benefits. So if you have the cross payment of you got both SSI and Title II benefits, this cross program recovery allows the SSA to reduce one payment to help pay for that overpayment. However, if the person is eligible for SSI, they will not adjust the monthly Title II benefit to recover an SSI overpayment. Cross-program recovery includes recovering a Title II overpayment from an SSI underpayment when too little SSI is paid to the particular month. There is a note down there that you're able to pay overpayments with MasterCard, Visa, Discover, whatever it may be. And if all reasonable efforts to collect, and this is more of kind of like just for your knowledge, anybody shouldn't panic. If you do have an overpayment, you should reach out to a DRC or a WIP for further instructions and help. But if a reasonable effort to collect an overpayment of $3,000 or more has failed, the SSA may refer the case to the Department of Justice for a civil suit. However, this event is very rare. Historically, overpayments taken up by the Department of Justice tend to be for very larger amounts. So next is requesting an overpayment write-off. So often Social Security tries to collect old overpayment amounts. This might happen when an individual becomes eligible for a new SSI benefit after periods of ineligibility, and it may also happen with no change in eligibility at all. Social Security must write off debt if it is at least 2 years delinquent, and there's a PLUM specifically cited there, so that way you can throw that at them. They would look at their rule book, and then they would read back the information that you need, or and tell you how it works. The debt is 2 years delinquent if it has been at least 25 months since the latest of the following events. So any one of these events can happen at any time, but the time frame starts from the most. If you receive the date the debt was established in the Title II computer systems, typically first, the date of the initial overpayment notice from the SSI debt, the date of the last voluntary payment, or involuntary payments do not count. The date of an installment or periodic payment arrangement if no payment is received. The date of an affirmation decision on the reconsideration request, and the date of a denial decision on the waiver request. So if you have one of these it's been 25 months since one of these rules has taken effect, you could probably request an overpayment write-off. So to request this, the beneficiary should send written requests to the local Social Security office. The request should include the date of the last triggering event from the list above, mention of the relevant PLUM section given in the topic above, which is also that one above, and a request that the debt be written off. Write-off is a quick and easy way to deal with old overpayments. And I did it again because I want to click that and it doesn't want to move. We can appeal an overpayment. So Social Security overpayments notices must explain the reason for the overpayment and details about how Social Security calculated the overpayment. Most of the time, these notices often fail to meet these requirements. And if the beneficiary does not think that they were overpaid or disagrees with the overpayment calculation, then they can always appeal it by requesting reconsideration. The beneficiary should file the form listed below. It is a request for reconsideration, and they can file that appeal online. You can file it in person, but you do typically have to interact with the Social Security office in some regard in that way. The request for reconsideration form must be filed within 60 days of the date the beneficiary receives the notice of overpayment, unless the beneficiary has good cause for filing later. This could be health issues. Collection of overpayment from current benefits should stop immediately when the request for reconsideration is filed, and the Social Security should not collect any more money until the reconsideration decision is made. Adverse reconsideration decisions may be appealed by request at administrative law judge hearing. This would be if your appeal fails and you think it needs to take the next step. Did I go backwards or did I go forwards? Request a waiver of overpayment. So if the beneficiary agrees that they have been overpaid and the amount is correct, or they appeal and they still owe an overpayment balance, the Social Security can waive the overpayment. SSA may waive the recovery of an overpayment if both the following conditions are met. The person is without fault, so it wasn't their fault. Maybe the rep payee wasn't paying attention. They didn't report out on time, so the individual is not responsible for their own finances. Somebody else is. This would be without fault. Recovery would defeat the purpose of the act because the beneficiary cannot afford to pay the money back. So you can't take blood from a stone kind of behavior. If the person's only source of income is SSI and the overpayment would completely destroy their SSI payment, the recovery would defeat the purpose. The beneficiary can request a waiver of overpayment if there is evidence that the beneficiary was not at fault and the beneficiary cannot afford to pay the money back without risking the ability to meet monthly basic needs, food, housing, water. I know there's two more. I can't remember off the top of my head. To request a waiver, the beneficiary should use the SSA form as noted there. And please note if a beneficiary goes to the SSA field office to request a waiver in person after receiving an overpayment notice, you might have to have a face-to-face interview before the end of the day, as it is required by the Social Security Act. There is no limit there is no time limit to request a waiver. But however, if the waiver request is filed within 60 days, then Social Security should not start collecting the overpayment. But if it's filed after 60 days, then the collection should stop until the overpayment decision is made. The last thing for overpayments is changing the recovery amount. So if the beneficiary must repay an overpayment but cannot afford the 100% collection rate for Title II benefits or the 10% collection rate for SSI, then they may request a reasonable repayment agreement. The beneficiary can file the form listed there and request for the change in the overpayment recovery rate. They can fill this form out online or you can do it in person as well. You should always print, sign. If you do it online, make sure you mail it or fax it. I prefer fax because it has the confirmation that it went through. The beneficiary will need to provide detailed information about their income and the expenses. Social Security will then determine how much disposable income they have available and to repay the overpayment. Social Security can reduce the monthly overpayment collection amount so the beneficiary has enough money to pay for ordinary and necessary living expenses. All right, it's the final push. Hopefully you're all still awake since we got through Medicare and Medicaid. Oh, that was overpayments too. But the last topic is New York ABLE accounts. So this is a little bit of information about New York ABLE, and then we'll get into what they really are. The New York ABLE Act was signed into law in December of 2015. The program was announced publicly in October of 2017. The website that they have offers enhanced features for improved accessibility, including adjustments for people with limited vision and a Spanish translation software of the websites and program materials. In July of year 2022, the state residency requirement was removed, and it allowed for individuals across the country to enroll in New York Able. And as of June 2nd of 2023, New York Able had 2,729 accounts open with 28.2 million invested. And since the launch, New York Able account owners have been able to withdraw over $15 million on qualified disability expenses. So a New York Able account or New York Able is achieving a better life experience, or New York Able, and it's programmed to help individuals with disabilities and their families. This will allow for saving for disability related expenses, earned income on investments free from taxes and used for quality disability expenses, and maintain their ability to benefit from SSI, Medicaid, and other federal programs. So who is eligible? So you have to be a U.S. citizen or resident alien with a disability that was present before the age of 26. They are working on raising this to 42, but it still has not been approved yet. And who certify that they are the following: are entitled to SSI or SSDI because of a disability, or are classified as blind and defined in the Social Security Act, or have a disability that is included in the Social Security Administration list of compensated allowances conditions, or have a written diagnosis from a licensed physician documenting a medical determinable physical or mental impairment that results in marked and severe function limitations that can be expected to last a year or can cause death. So the account owner is the beneficiary in contrast to a special needs trust or 50 or 529 college saving account. Eligible individuals can only have one Able account nationwide. So once you open up one, that's your account. You can't go to another state and open up another one. Anybody can contribute to the New York Able account. They actually give you a QR code that people can scan on their phones and distribute contributions that way. So total balances of all contributions combined must not exceed annual contribution limits, which is pretty high, and we're going to get into it in a second. Who can open a New York Able account? So eligible individuals or a person selected by the eligible individual can open the accounts. If an eligible individual lacks the legal capacity to open an account, one may be opened on their behalf. Any of the following work: so power of attorney, conservation or legal guardian, spouse, parent, sibling, or grandparent of an eligible individual, a representative payee appointed to the individual by the Social Security Administration. So what is a qualified disability expense? This is an expense that is incurred as a result of living with a disability and is intended to improve the health, independence, or quality of life of the disabled individual. Qualified disability expenses include the following, and they're very broad. So, for example, when we talk about health and wellness, when we received this training, we learned more information about it. The lady did describe how taking a vacation with Able account money is for health and wellness, because it's a very broad definition. And health and wellness ties into that because you're taking time away, you're decompressing from stress of day-to-day life. So every one of these things is a very broad statement. So education, health and wellness, housing, transportation, any legal fees, financial management, employment trainings and supports, any assistive technology that might be needed, personal support services, oversight and monitoring, and funeral and burial expenses. All are covered under a qualifying disability expense with an Able account. So as of right now, as of this year, contributions can be made up to $18,000 annually. So an individual can put up to $18,000 in their New York Able account annually as of 2024. Income earners may contribute an additional amount of up to $1,359 or $590 in 2023. I will send the updated amount to Patria when I send her the other information for 2024 for anybody who is an income earner as well, or their annual income, whichever is less. So if you make under the limit there, you can put your whole income in there, but you can only put up to a certain amount. The maximum account balance is currently $520,000. I'm sorry, it's been a long night, tripping over my words. And contributions are monitored by the New York Able program to ensure that limits are not exceeded. So they do monitor them, and they will give you calls, and they will tell you, hey, this is what's happening, and they'll go over it with you. So Able accounts and the impact on SSI benefits. So balances of $100,000 or less are excluded from an individual's SSI resource limit. Only the amount over $100,000 is counted against the resource limit, and typically ends up with a spend down kind of feel where they're going to notify you, hey, you have over your resources, you need to spend down and get your resources back under 100,000 or 2,000, whatever the limit they're talking about. If an Able account causes the account owner to exceed the SSI resource limit, then SSI benefits will be suspended until the account balance no longer exceeds $100,000. Contributing and withdrawing from New York Able accounts. So you can contribute funds by check, payroll from direct deposits, reoccurring contributions, electronic fund transfers, online gifting, or rollovers from 50 or 529 accounts or another state Able account that you folded into New York Able. You can withdraw funds by calling New York Able's toll-free phone number. You can get a debit card or a checking account provided by them. You can request it online through the New York Able page. Automatic withdrawal. So if you do have the card, you get automatic withdrawals. There is no cap, I don't believe. And there is a downloadable paper form on the New York Able website that you can submit through the mail if you choose to do it that way as well. So enrolling in New York Able. So you can enroll online or download a paper app from that website. The information that's going to be required is obviously the name, the date of birth, address, social security number or tax identification number, a phone number for the eligible individual, basis of eligibility, and category of disability. You can choose to invest in New York Able accounts. I'm not the professional in this, so I chose to keep this out of the slide, but I did keep it in there because I did send the slides out in the early stages of the webinars, but we can always send it again, where they talk about their investment options and all those things. I would always, as best practice, suggest if that's the route you're going to take, that you call them and learn more about it. Get started, and you can get started with as little as $25 or $15 with a payroll deduction. So that's all. You just need $25 to start the account, and then it's open, or $15 if you have a payroll deduction. And that is it. Any questions?
Sorry, I was turning my camera back on and my microphone, and right now I don't have anything in the chat, but the Able account is really fascinating to me. That's a great feature, all of the things that you can use that money for. I think anybody who was not aware of that, I'm glad that you shared that. And I hope they raise the age, because I'm assuming they're considering raising the age due to people who may get disabilities from work or military service or something like that after 26. I'm assuming, is that why? Or from like an accident?
I'm assuming that's a good push towards it. So anybody who is diagnosed with a disability over the age of 26 is technically not able to apply for these. So yeah, I think the big push is for obviously 35 to 46 range, and to really help them as well as helping younger individuals, or somebody who's had a disability from a longer period of time.
Yeah, no, that's all. I hope that goes through for
Yes,
those
so
people
do
in
I.
those.
That's a great boost if it does.
Yeah. So if you'd like to advocate for that, contact I don't know who you would contact, but you can
I
advocate
don't
for
know
it.
either.
Any questions from the group? I mean, there was a lot of information tonight. Like I said, I will send this out so you can re-listen to it as many times as you need to. But Mark, Jill, or Erica, do you have any questions for David? This is your chance. You can unmute, you can put it in the chat, whatever might work. No problem, Mark. Thanks for letting me know. If you don't have any questions, thank you, David, for another great presentation. I think this is our last one, isn't it?
This is our last one.
Oh, this has been, I mean, I have learned so much during these, and I hope everybody who's joined us, whether you've listened afterwards or not, has enjoyed. Hi, Mark, I can see you.
Hey, how are you? Just wanted to say thank you to both of you. We appreciate it a great deal.
Oh, no problem. I'm glad you could join us, and I hope it was helpful.
It
So,
was.
hi,
Yes.
Erica, I can see you now.
Hi.
So everybody's popping up.
Thank you.
Was it
Thanks.
helpful for you, Erica, as well?
Yes.
Yeah, awesome.
Yeah.
Awesome. Well, like I said, I will send this out. So if you need to re-listen to it or share it with anybody, please feel free. Reach out to David with any questions. And I like, there was a lot of emphasis tonight on how the DRCs and the WIBs can help you through this process, whether it be overpayment, whether it be Medicaid, Medicare, you know, all of that. So they are a great resource to all of you. So
And if we don't have the answers, we will seek them out. 'Cause that's 95% of our job.
yeah,
Thank you. Thank you both very much.
no
Yes,
problem.
thank you.
Have a
Have
good
a-
night.
Have a great evening.
Bye-bye.
You too.
Bye.
Bye.
Hold on, David. I'm trying to